Welcome to Prepared for Parenthood, the podcast for hopeful, expectant, and new parents with little ones up to age 5, as well as the professionals who work with them. I'm your host, Dr. Stephanie Dueger, a psychotherapist, author, educator, parent coach, and married mother of 2. On this show, we'll discuss everything from the most up-to-date practicals of best supporting your young children, to thriving in relationship as a family, to more surprising topics around the psychology and development of babies and children from conception through age 5. So sit back, relax, and enjoy. I'm thrilled to have you here today. Welcome back to Prepared for Parenthood. Our guest today is Ana Grantham, a lactation consultant with nearly 30 years of nursing experience and advanced training in breastfeeding and lactation medicine. She's the owner of Finding Peace Lactation, where she provides in-home, in-office, and virtual support for families in the early postpartum period. Ana has completed over 200 hours of advanced lactation education, including a rigorous 2-year program, and specializes in complex feeding challenges such as pain, milk supply concerns, and feeding dynamics. She's passionate about helping parents understand the why behind feeding issues so they can move forward with clarity, confidence, and a sense of peace. Welcome, Ana. So happy to have you here today.
Thank you for having me, Stephanie.
So let's talk breastfeeding. Clogged ducts, mastitis. These are things that lots of expectant and new parents hear about, probably worry about. Can you explain what these are and what do parents need to know about how to manage them?
There are a lot of horror stories that moms hear when the prenatal period, I feel like, and one of those is clogged ducts and mastitis. And there's a misconception out there because the name really implies clog. And so most of us, when we think about a clog, I think of a tube that has a plug in it that we need to get out. And that brings to mind things like plungers or really squeezing, trying to get something out. And so that's like the kind of measures that a lot of families take when they think that they feel a clogged duct. And to understand what is in our breasts is very important to understand the root cause and how to appropriately treat these things. So many times when people are feeling what they say is a clogged duct, is they're feeling lumps in their breast. And some of us may feel some soreness right before you get your period, and you might feel some of those lumpy areas in the breast. And when we're lactating, it's very similar to that, where you can feel some little balls in your breast. But those are collections of lactocytes, milk-making cells. And the more full that they are, the more you're going to feel them. And then as the milk is released, they kind of relax back down some as well. Those are not clogged. That is glandular tissue. And it's something that really we shouldn't be mushing on and trying to get out, because if you massage it too deeply, you can actually rupture some of those cells, leading to a galactocele or an abscess, and for sure creating more problems than it's helping. What clogged ducts really are is inflammation. The ducts in our breasts are as fine as the hairs on our, and so that's not something that you're going to push and move out of the breast. And the drainage of our breast is actually in the lymph nodes, supraclavicular lymph nodes and axillary lymph nodes. And so rather than trying to push towards the nipple, which would be a bottleneck, really what we want to do is have women lay on their back and allow some drainage to occur this direction and this direction, because that's the lymphatic drainage of the breast. The clog is actually so much inflammation that it's squeezing tight the ducts that exit from our breast so that it can't exit. And when we relieve that inflammation, then the milk can flow. And so you might notice this in the early postpartum period, like when secretory activation occurs, which is when the milk comes in. That's usually day 3, day 4, and when oh my, it's swollen. And they think that they're really full of milk, but it's actually a lot of swelling that's there. And so ice can help relieve this. Laying on your back, relieving that dependent edema when we're standing up and we have fluid accumulation, it'll happen in our ankles, and it happens anywhere that's dependent, like the breasts that are hanging down. And so when we lay on our backs, that actually helps to relieve some of that dependent edema. It can drain lymphatically in those areas. And that can also help babies latch as well because it helps with the swelling. Mastitis is an inflammatory process. And so while there is infectious mastitis that happen from wounds that are unhealed, and that's a path of entry for bacteria to be able to enter the breast, what's much more common is inflammatory mastitis. And mastitis exists on a spectrum. It's very common for things to start as inflammatory mastitis. And the risk for inflammatory mastitis is stimulation that exceeds milk removal. So people that are really concerned about, oh my goodness, I'm going to make a really big milk supply, or I need to have a stash, and are watching things on social media that show these chest freezers full of milk, and that is what their goal is. That's what puts people at big risk for inflammatory mastitis, is really ramping up milk production to be higher than what the baby needs or will ever need. And then an abrupt change, like, oh my goodness, and then I skip pumping for blank number of sessions. When milk production exceeds milk removal, that's a significant risk for inflammatory mastitis. And when that's caught early and treated early with things to help lower milk supply, using ice, ibuprofen if you need it for pain, and lymphatic drainage, then we don't need to treat it with antibiotics. It usually is getting better. It may not be wholly better in 24 hours, but as long as it's improving, then we don't need antibiotics. If those symptoms are not improving in 24 hours, then we.
I remember when I was nursing my children, some of my midwives told me put cabbage leaves on your breasts for challenges around the inflammation piece. Is there wisdom in that?
I would say that the wisdom in that is that most of us keep cabbage in the refrigerator. And so those were probably cool leaves, and that can feel very good. But is cool cabbage any better than ice packs or frozen peas or whatever delivery method you want to use for coolness? No, cabbage doesn't have any special properties, but the cool was right on.
So maybe just the way the leaf lies on the breast
Sure.
maybe is helpful. Yeah. Okay. Good to know. So I never needed to do triple feeding, but I hear from some of my clients that that is something that they've been encouraged to do in the early weeks. And I'm curious, can you just share what is triple feeding? Why would it be prescribed by people? Is it actually helpful? And how do you prevent it from becoming overwhelming or unsustainable?
Triple feeding, for people that are not familiar with it, is where you're feeding three things. So you feed the baby at the breast, and sometimes people will limit that and say just 10 minutes and 10 minutes, but that's the idea, is that you feed baby first. And then you're feeding the pump because you're pumping with a double electric pump. And then you're feeding the baby again via bottle or cup or some other method, the milk that you pumped, or that in addition to some sort of supplementation, because the triple feeding usually is done in situations where there needs to be some supplementation, that the baby has either lost too much weight or has a high bilirubin level, or perhaps has had unstable blood sugars. And so more than just nursing is necessary. And that's something that is often started in the hospital period. And then fortunately, sometimes people go home, and I've met families who said, I triple fed with my last baby for 2 or 3 months, and my heart breaks when I hear that. That is a recipe for really poor mental health for the whole family. That whole process can take 45 minutes to an hour. And when we consider that newborns eat every 1 to 3 hours, then families no sooner finish this entire process, then they have a whole bunch of pump parts that they need to be cleaned, bottles that need to be cleaned, and then it's time to start all over again. So that leaves no time for sleep and recovery and all of the things that humans need to stay well. So Triple feeding in my practice is something that I ask people never to do more than 3 times a day. I don't personally feel that it's sustainable to do that for every feeding when you consider that newborns feed anywhere from 8 to 12 times a day. I think that the reason that a lot of people do that for every single feed is because they're really afraid that if they don't breastfeed their baby at every single feeding, that the baby will not breastfeed in the future. And people hear a whole lot about nipple confusion. Babies are very smart. They're not confused. They have a flow preference and they're imprinting early on. And the way that they've been fed is how they expect to be fed. So triple feeding is something that I do have families do sometimes, but usually no more than 3 times a day. And the rest of the time they can pump and bottle feed. And as long as that baby is fed with pace bottle feeding, which is where we make the bottle feed very similar to what it's like to feed at the breast, then we usually don't have any problems with the baby losing the skill of being able to breastfeed. And if they grow in their ability to be able to extract milk from the breast, or as the milk supply increases, then we work towards more breastfeeding and work away from feeding.
I'm thinking about people whose baby has been in the NICU and they're maybe just returning home after however long baby has needed to spend in the NICU. What's your experience? I know every case is different, but having them get off to the best start with breastfeeding at home, or maybe some of them are not able to breastfeed. How do you navigate families who are struggling with things like that?
Sure, you're right that every NICU story is a little different. It depends upon the gestational age of the baby. But there are some things that are just universally good, such as being skin to skin. And I think most NICUs are very good about making time for both parents to be able to do that. Some NICUs focus on kangaroo care, which has a lot of evidence behind it for helping to stabilize heart rate. And being skin to skin with babies is medicine. And that doesn't stop being good after being in the NICU. It's very good for families to hang out skin to skin when they are at home, because feeding is a instinctive behavior for babies. They have reflexes when they're born to kind of push their way up to the breast. When they're laying prone on their parent, they push with their hands up to bob all around and look for that breast. And then they have the rooting reflex where when they hit themselves on the cheek or sometimes with your hand, they root to see like, oh, where is the nipple? And then when they finally get there, then we all see them go and kind of fall face first on the nipple. And that doesn't disappear for a while. So being skin to skin, and especially in a semi-reclined position such as laid back, sometimes that's all that babies need to begin to look and do their dance to find the breast. Other things that can help are the peace feeding that I was speaking about, which is it's very important that babies are sucking without getting any milk for at least a good 30 seconds when we're giving a bottle, because at the breast, babies need to stimulate. They need to suck very fast in order to stimulate a letdown. And when we feed babies, many of us were taught to hold our babies like this and hold the bottle and boom, immediately have something that pushed into their mouth and starts to flow really fast. That's not how breastfeeding works. With breastfeeding, the tongue needs to extend and cup and bring that nipple and reeler tissue into the mouth. And they might get little drops at the beginning, but they need to suck fast in order to stimulate a letdown. And so doing that with bottle feeding helps them not be angry and mad when they come to the breast, and it doesn't work like bottle. And for some babies, we need to use the supplemental nursing system as a stepping stone to direct breastfeeding. I usually call it a straw. It's a little tube that we can just poke in their mouth when they are sucking at the breast. So they get the instantaneous milk that they want. They can get it in large quantities. And that will often settle a baby down and get them to continue nursing at the breast. And we go from there. It is very individual. It requires listening to the baby, watching them, and seeing where their points of frustration are and seeing what we can do to eliminate those.
And with a baby who is using a bottle, if you want to slow down, like they have to work to actually get the milk because you're trying to help them learn to breastfeed, but with a bottle, what's the process around keeping the milk from just going in as soon as they start sucking on that?
You have to see how each baby is tolerating this. But for most babies, we want them in a sideline position. So if this is their mouth, they're with their mouth this direction. I usually have them sitting on my lap. And the bottle is going to be horizontal to start with no milk in the nipple. And a lot of people will worry that, oh my goodness, the baby's going to colic or they're going to have so much gas, etc. That's not usually a concern. It's something that they're mostly going to breathe out again. And if they do swallow some air, that's not the end of the world. So after they've been sucking for a little while, then we just tip the bottle up and watch for them to pace themselves. Because when we watch babies nurse at the breast, they suck, 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 and then they have a little pause, and then they get going again, and then they have another pause. And especially the older that they get, they might pause and look up at you and smile and leave milk at the corners of their mouth. And we want bottle feeding to be like, and so if babies get a large volume right away, they're very adaptable. And so they might choke in the beginning when you start offering bottles and they're like, oh my goodness, this was too much. But they quickly learn how to adapt to that and to expect it. And so what I would rather do with bottle feeding is to help them adapt to, oh, we don't chug it all at once. We take up to 5 swallows. And if you haven't paused to take a breath, I'm going to tilt that bottle down so that they can take some recovery breaths. And you'll usually see them go. And then they're really excited to start sucking at the bottle again. And they'll start, oh my goodness, where is it? And then you tilt it back up again and let them take some more and watch for them to pace themselves. Some babies will pace themselves where they get over that initial hunger and they go, oh, I'm okay. I can pause on my own for a minute, take a breath and relax into the feed, because bottle feeds in the beginning should take about 20 minutes.
We've been speaking today with Ana Grantham. She is a lactation consultant with nearly 30 years of nursing experience and advanced training in breastfeeding and lactation medicine. Ana, can you let people know how to find out more about your work, get in touch with you if they have some questions or thoughts?
Sure. The best place to reach me would be through my website, which is lactation.com. You can learn more about me, my services that I offer there, and it's also got a contact me page.
Thank you so much for being here today, Ana. It's been so helpful. You've brought so much amazing information for our listeners. Really appreciate you taking the time today.
You bet.
Take care. Thank you so much for listening to the Prepared for Parenthood podcast today. I hope you found this episode educational, informational, and conversational, and that you'll join me again for another episode soon. If you enjoyed listening to today's podcast, I'd very much appreciate if you would rate, review, and subscribe. If you're interested in more information related to today's podcast, or are looking for parent coaching or courses, you can find my information in the show notes or online at preparedforparenthood.com.